All
Oh,
right.
okay. There you go. Sorry about the technical difficulties, everyone. But hello, Dr. Freddie. Welcome to the chat.
Hello,
How are
hello.
you?
Doing well. How about you?
I'm doing good too.
All right.
Yeah,
Excited to have another IG Live. It's been a minute.
same. I know. How long? It's been a while. Maybe since like last year?
Probably last
Yeah.
year. I don't remember doing one this year, but
Yeah.
glad to be back
Yeah.
on these IG Lives. Say
So many.
hello to everyone. Welcome, welcome.
Hello. Okay. So for today's topic, we're going to be discussing the Echo podcast. I don't know if you guys have been seeing it on our social medias, but the Echo team with Little Manila has been publishing a few podcast episodes, a lot of them with Dr. Freddie, of course, as our special guest. And we're just going to be going over that experience, kind of answering your guys' questions about any COVID-related things, health-related things. So throughout the live, feel free to add comments as we're talking. We have our amazing Echo coordinator, Angie. She is actually on the Echo Little Manila account, and she'll be making sure we get back to your guys' questions. Before we get into it, I can introduce myself. I'm Haley Escorpiso, and I am with the Echo team as the program coordinator. And then we have Mr.
Hi, everyone. My name is Freddie, Dr. Freddie Ray Ray, if you want. I'm a critical care pharmacist. I focus on different specialties, including neurotrauma, medical surgical ICU. I've worked in a COVID unit, and more recently have taken on some roles, including precepting pharmacy students and things like that. So, yeah, welcome everyone. As you've seen in part of Echo, part of the podcast, we have a couple podcasts out. And I think we have one coming out tomorrow or sometime this week, so that's awesome. So we wanted to hear back from you guys to kind of start off. This is kind of behind the scenes. You know how in reality TV shows they're talking about like, oh, what did you think about this situation? But in honesty, we wanted to kind of follow up. We had a couple of good podcasts with a lot of different information, including allergies, and that sort of thing. So fire away. Otherwise, Haley, has anything come up as far as from the community, as far as questions or anything about the podcast or anything?
Yeah, so we can just get right into it. One of the first things that we kind of heard from the community was what is like this new COVID variant that has been going around. For me personally, I actually know like some COVID cases are increasing based off what I've seen, and I was wondering if you were able to kind of touch on what this new variant is.
Yeah, so in our previous podcast episode, we talked about the Kraken variant, which is XBB 1.1 or XBB 1.5. And so currently that one consists of 64% of the cases in the United States or around the world, at least. And the new strain that's coming out is called XBB 1.16, and the cool name for it is called Arcturus. And I'm like, that's not as like scary as the Kraken, but what is an Arcturus? So I kind of looked it up, and it means guardian of the bear, and it was the name given to the brightest star of this constellation called the Boots constellation. So all that means, so that's kind of interesting. I think it's a cool name, but getting down to the nitty gritty, it makes up about 15% of current cases here in the United States. So it's a variant that the World Health Organization is interested in monitoring. We see it in about 30 countries around the world, including the United States. So it's something that is kind of probably going to be the next variant that takes over. But in general, as far as some of the differences when we talk about the Kraken versus Arcturus, the biggest difference that some physicians have reported, and this is more like word of mouth or more of like observation versus clinically we know a lot of information, is that some people are getting what's called pink eye or conjunctivitis. So one reason, maybe, I'm just hypothesizing, we don't really know the connection, is that maybe COVID is getting so contagious that as we've gone through the years, we've seen COVID go from the deep parts of our lungs all the way to like the upper lobes of our lungs and now to the throat. So we had like with Omicron, the burning throat sensation, right? And then now as COVID continues to evolve and kind of stay alive and more contagious, it lives in parts closer to the surface, so like in our nose, and maybe some of that virus is getting attached to the eye, because obviously your eyes are a mucous membrane that kind of sits on the surface of your face.
Yeah.
Yeah, so we see some comments here. Yeah, pink eye, exactly. So if you're not familiar with pink eye, some of the common symptoms would be that the white parts of your eyes would be red. You'd have some itchy, irritated feelings. Sometimes people blink and they feel kind of grittiness or sandy feeling, as if you got sand in your eyes. Some people might have hazy vision or blurred vision when they have these infections, and in some cases, some people might have discharge or mucus coming out of their eyes, and sometimes physicians and healthcare professionals will characterize patients who wake up in the morning with pink eye as having like a crust of like nasty stuff. So when they wake up, they can't really open their eyes, and that sort of thing in the morning. So that is one of the newest symptoms that people are reporting. Until we get more data, that may be the case as far as this new variant. Some things that are the same with this new variant include some of the same symptoms. So we talk about fever, runny nose, cough, fatigue, congestion, muscle ache, and that sort of thing are still in play. But yeah, that's kind of the gist of it for this new variant.
Yeah. And then
Yeah.
I see another comment in the chat from Kojo Mojo. He says, allergy season is hitting really hard right now. Some of my family members say their eyes get itchy and the top of their throat gets itchy too. I never heard of the top of throat being itchy.
Yeah. So to kind of recap some of the symptoms with, allergic rhinitis or seasonal allergies, we have, runny nose, itchy eyes, scratchy throat, and a lot of the scratchy throat and kind of itchy throat kind of comes from the fact that your immune system is overreacting, creating extra mucus in your nostrils, and when you sniff, obviously some of that mucus has to go somewhere, so if you don't blow it out, it's going to trickle down to your throat and maybe irritate the areas of your throat. So we call that kind of postnasal drip. So some people might have an irritated throat, they might have an itchy throat, that sort of thing. But I'm so sorry to hear that, Kojo. Yeah, for me personally, as someone who's had allergies since forever, especially living in Stockton for all these years, this is the first year that I've actually had pretty severe like eye itchiness, to the point where sometimes at work I have to put in some antihistamine eye drops. So I take an antihistamine every day, which is Allegra for me personally, or fexofenadine. And then sometimes if my eyes are really, really red and dry, I'll take ketotifen or Zatador, which is an antihistamine, kind of like Benadryl but for your eyes, or like Allegra for your eyes. I know that some people take like nasal sprays and things like that as well.
Yeah. Oh, and then we see another question from Quincel Q. Would you recommend the booster after getting this new Omicron subvariant COVID infection, Arcturus?
Arcturus, yes. So, so the current CDC guidelines recommend staying up to date with at least one booster. So if you have your 1 or 2 initial doses and then you get your booster, you're pretty good. For patients who are 65 and older or immunocompromised, they're now starting to recommend, and I haven't really seen this in practice being rolled out quite yet, but potentially some people in the immunocompromised group or elderly might get a second booster. I believe it's 6 months out, but I haven't seen like formal recommendations for that personally, like in my practice. But it might be something that we see this summer when more people are gathering, or closer to this fall. But in general, I think we're at a good point. So we're kind of at a shift. We talked about in some podcast episodes how we're not really in an emergency situation anymore, pushing the vaccines and the boosters. We've done our best, and it's really trying to protect the communities that are higher, like most at risk. So we talk about multi-generational families a lot, so elderly patients, grandpa and grandma, Lola and Lolo, making sure they're up to date with their vaccines, and if they fit the criteria for being immunocompromised, maybe they can get a second vaccine. But for most people, it's not really super recommended until we know more about these new variants.
Right.
Yeah.
So follow-up question to that would be, do you know if infants can get their boosters? Is there any updates to that?
Yeah, so as far as infants, I haven't seen any updates from what is currently available. So they can get like their primary series.
Right.
As far as the bivalent, I believe it's for adolescent children. I can't remember the exact age cutoff, but as far as babies, like infants and things like that, I don't know exactly what the data is for that quite yet. I know that last time we talked, they're still kind of studying that sort of information.
Right. And then there's another comment we wanted to uplift. Len111 says, I've seen online the daily use of Zyrtec and Benadryl and other allergy medicine can cause dementia. I wanted to know what's the best way to alleviate allergies.
This is a great question. So this is a popular sort of notion, especially when we think about Benadryl. Benadryl is a medication that's obviously antihistamine, so it helps with allergies. But it can also make people sleepy, maybe unable to operate a motor vehicle, that sort of thing. And so some people might connect the dots and say, hey, this medication has sort of different, it affects the body in a certain way, maybe it affects the brain. And so I looked into the studies that were kind of backing these sorts of claims. And what I found personally is the studies that were done were great. They looked at medications called anticholinergic medications, kind of like Benadryl, which dry up the mucous membranes. In the case of Benadryl, helps with allergies. And they found that in elderly populations, there are patients who are at a higher risk of dementia, but that's by taking other anticholinergic medications. So without getting too nitty-gritty, some patients might be on medications to help them use the bathroom, so to relax their kind of like bladder muscles and that sort of thing, or to help with people who are going to the bathroom too much and kind of keep their muscles in a way where they're not going to the bathroom randomly. And in those patients, they found that those medications were used more often than Benadryl. So it's inconclusive. I personally think taking Benadryl, for an acute period of time, so maybe like a few days at a time and taking a break is okay. If you're someone who's taking Benadryl daily over like a whole year, maybe it's time to reevaluate and get a better allergy medication. So maybe instead of taking Benadryl, you want to try Claritin, or you want to try Allegra, or you want to try Zyrtec or Zylsal, which is another medication that just came out. You might want to talk to your allergist or your PCP, your primary care physician, for hydroxyzine, which is a prescription medication that's in the family of Benadryl, but maybe doesn't have some of the same symptoms as far as like sleepiness and cognitive ability.
Right.
So you might want to look at those options, or maybe you want to look at what's going on at home. We talk a lot in that podcast about allergies can be affected by allergens. So maybe it's about looking deeper where in your living situation. Is there a way we can help clean up the area, or remove mold, remove things that might cause you to have allergies?
Right.
And sometimes that's always a challenge. That's a challenge about it, is we live in a, most people that are all listening to this podcast or listen to this IG Live, or our audience, live in the Central Valley, so it's hard to avoid pollen.
Yeah.
But you kind of want to just try your best to see what is the cause, and see if that can help you, and in addition to that, optimize your therapy. So if you're taking Benadryl chronically, you might want to find something different. Nasal spray plus Allegra, or PO medications. Hope that helps. But to kind of answer your question again, the long-winded question, no, there's not a lot of great data to support Benadryl specifically causing dementia. So I think it's okay. I mean, some days when my allergies are really, really severe and I've already taken my Allegra, I might take a low dose of Benadryl just to kind of get me over that initial hump. So I don't recommend that to everybody, but if you're having really, really bad allergies and your current daily medication is not working, Benadryl is like a good way to kind of get rid of that extra histamine in your body.
I actually didn't know that about Benadryl. I kind of only thought it was more so about like I would use it as a replacement to like an EpiPen. So maybe I'm not
Ah,
taking it right.
well, so I mean, Benadryl has a lot of good uses, and I think that's why that it's a great medication to keep in your back pocket, or so to speak.
Yeah.
It can help with people who have severe hives or allergic reactions, but their airway is still open.
Yeah, yeah.
So that sort of thing, like food allergies specifically, like take a Benadryl if you're allergic to something, but just to get hives
Yeah.
versus taking an EpiPen. But some people do use Benadryl for like daily allergies. I know that when I used to work at Walgreens in Stockton, a lot of families found Benadryl to be the most common one in their household because they didn't know or they couldn't afford like the brand name Claritin or didn't know about Walgreens version Claritin or that sort of thing.
Yeah, and then also since we're already on the topic of allergies, I know you guys had an allergy podcast episode where
Yeah.
you guys gave recommendations, and I know you took note that some alternatives to name brand allergy medicines can be found at Costco as well. Yeah.
Yeah.
So, mhm.
Oh, go ahead, go ahead.
Oh, I was just gonna say, like, after I saw that clip, I was like, wait, I didn't know that. So I went to Costco and then I saw, like, there was actually a bunch of different, like, off-brand allergy medicines. Like, there was a Claritin one, there was, like, one that looked like an Allegra, one that looked like a Zyrtec, I believe. So I ended up,
Yeah, exactly.
yeah, I ended up getting the one with Claritin, or that looked like Claritin. It was way cheaper than the real Claritin, but
Do you,
it
do you
does.
remember how much you saved, just out of curiosity, or
Um,
how much you bought versus the Claritin? Because they do sell Claritin too, right?
yeah,
Like you can get
so
like, for example, 50
yeah,
Claritin for X amount of dollars, or you can get 100 Claritin for like
yeah,
half the price, right? So it's
yeah.
kind of crazy.
That's why they had it like right next to each other, and I was like $11 for the Costco Claritin, or for like $30 for the real Claritin. So it was a
Exactly.
big gap, yeah,
I
and
think
it works. Yeah,
there you go. That was getting my second question is like how's the efficacy? And so a lot of times some patients might not know that the brand name medication is and the generics are the same, and
mhm.
you just save a lot of money. So it worked okay for you.
Yeah, it's been working.
Nice.
I think I don't know if it is like supposed to be like an automatic kind of like my system gets used to it. Maybe that could be a question for you. Um, but I think it really like all my sneezing, my runny nose and stuff, like my congestion and all that, it all went away. Maybe like in uh, a week after taking it like regularly. Um,
Okay.
yeah, so it took a little
Interesting.
bit, but it worked. And I was taking I think it's the Allerflow, the nasal spray, I
Yeah.
believe. Yeah, that was helping a lot as well.
Nice. Yeah, yeah, yeah. So, to answer your question, before we get to that, yeah, Walgreens, CVS, Costco, all of those places have the generic versions. You just have to look at the ingredients. So look at the active ingredient. So like for Allegra, it's fexofenadine or Claritin, it's loratadine. So you look for that specific ingredient, and if you look like the next door neighbor, like up and up at Target, you just look for the loratadine, and it should be the same dose. So
Yeah,
awesome. That's awesome. I'm so glad that you use that
yeah.
advice. That's like the number one thing I try to tell patients because they don't know. But
Hmm.
to answer your second question about like why did it take a little bit longer,
Hmm.
a lot of brand and generic medications are like 99% the same. They have to be in order to be called like interchangeable therapies. That's what we call it in the pharmacy. So, for instance, when a doctor gives us a prescription for Claritin and the patient's insurance covers the generic brand, we can just change it. So they have to be pretty equivalent.
Hmm.
It might be the case that the Costco version, so besides the active ingredient and the medication, so like every tablet, there might be something else in there as well to keep the tablet like stable.
Yeah,
Kind of like when you look at foods that you buy, like chips or whatever. There's other ingredients that help keep the chips or whatever fresh.
yeah.
Same thing with like generic. There's a different set of ingredients compared to the brand name ones. but they do the same thing, and maybe your body was just getting used to that. Maybe.
Okay. Yeah,
Yeah.
maybe.
But they should be 99% the same.
Yeah. I'd say, I mean, it's worth the money.
Heck yeah. I mean, $20, so you get $20 every 3 months savings.
Yeah.
Like you times that by 4, that's $80 a year.
Yeah, and in
Um,
the one I bought, I believe there was like 150 pills in it. So
yeah,
it lasts a while, for sure.
exactly. That's awesome.
Yeah.
I see here Echolita Manila. Yep, saved $48 last time. Exactly. Like generics, generic, unless it's like an experimental medication or like a cancer medication where there's not really a lot of different, generics for those things.
Right.
Nice.
Awesome. I'm so glad that we're bringing more awareness to that. Not sponsored by Costco, but okay, so I wanted to move on to the next question
Yeah.
that came up from the community. It was, well, we kind of touched on it already, but is it okay to use both a nasal spray and allergy medicine at the same time?
Yeah. So let's take the example again of Claritin or Loratadine or Allegra.
Mhm.
So that's an antihistamine. It attacks the histamine that is made from your immune system. So that's like one pathway. And then you add a Flonase or Allerflow, which is a nasal spray. That's a steroid that helps with decreasing inflammation. So when you use two different medications like that, they attack the allergies from different areas. So so you think about like someone who has a runny nose. If you take the oral medication, it will help systemically, like throughout your body, remove the things that's causing the runny nose. In addition, if you have an itchy eyes or a runny nose, you might want to use something that directly attacks the things that are causing the symptoms in your nose. So use a nasal spray. So you kind of attack it from both angles, and so that's how we think about it with like healthcare in general, which is why some people aren't different medications that attack the same disease state. But short answer, yes, you can use both, and you can even do a different combination. So like you can do an oral medication and eye drops. So if you are someone who has some congestion, and you don't have really runny nose, but you have really, really, really itchy eyes, then you might want to do eye drops and the PO medication. If you don't like PO medications and you have very, very mild symptoms, maybe you'll just do the nasal spray and the eye drops, or you'll just do one or the other, that sort of thing. Some people also have, they can report maybe sometimes they have itchy skin or redness, that sort of thing. So maybe you do like oral medication and then you combine that with like a cream, like hydrocortisone, or Benadryl cream, or something prescribed by your physician.
Yeah, that sounds good. And then another topic that came up as well is kind of with the new variant, right? I've heard that it's kind of getting harder to differentiate between a COVID, a cold, and allergies.
Yeah.
Yeah, so that's been going around. And with that, another question is, are fevers a symptom of allergies usually?
Great question. So let's kind of go back to the basics. All right. So with the common flu and cold and COVID, you get some of the same symptoms, right? So you have cough, congestion, fatigue, muscle aches, fever. The difference between COVID and the cold, although maybe this is getting a little bit more similar with these new variants, but with the cold, usually you get all the symptoms like right off the bat. So after you get exposed to someone who's sick, in the next day, 24 to 48 hours, you have all the symptoms: runny nose, congestion, sore throat, fever. With COVID, I know that when I got COVID in October, and maybe this is a little bit shorter, there's a shorter time duration with these new variants, but for me, I had a scratchy throat for a day, and then the next day I had a sore throat, and the next day I had cough, and then the next day I had congestion, and the next day I had a sore throat. So it takes a long period for the symptoms to kind of arise. And with this new variant, I think that they mentioned that that's kind of cut in half. So maybe instead of 5 days of getting all the symptoms, it's like 3 days. So it's harder to differentiate. So how do you differentiate between a cold and COVID? You just got to take a COVID test. And
Yeah.
then this is a good chance to remind you guys. So I know that I've had a lot of colleagues and friends get common cold over the last few weeks, and also had a couple people get COVID.
Mm-hmm.
And so one thing that I think is missing here is when to test. So I know that last year we talked about testing, and the best way to test is within 48 to 72 hours after getting your symptoms, and all the way up, or at like 5 days after exposure, that sort of thing. And then all the way up to like 10 days, or depending on how your employer would like you to test again. But some people are testing right away, right when they get like an itchy throat or something like that. It might be too early, so you might want to just follow up a test 48 hours later.
Okay.
Yeah.
And then,
Oh, and then for allergies, yeah, thank you. For allergies, the biggest difference is you're not going to have a fever. So you might get some cough because your allergies are so severe and the mucus and stuff is kind of creating this response.
Yeah.
You might get a runny nose. You might get some congestion because of allergies. You shouldn't get any muscle fatigue. So that's another one that's not really common with allergies. And that's pretty much the main differences that I could think of. Oh, and then I guess another difference would be that with seasonal allergies, they only happen in certain seasons, unless you're like me, who gets allergies year-round.
Yeah.
And then allergies can actually be treated with like allergy medications, and then they go away.
Yeah. So just to reiterate, you said with allergies and COVID, differentiating between those two, you don't get a fever, and it was the body aches, I believe, or muscle aches?
Correct. You don't get muscle aches.
Mm-hmm.
Yeah.
What would you say about, like, because I know sometimes when we are congested, we kind of lose our sense of smell or taste. Is that a common thing for allergies as well?
Not necessarily, especially not taste. You should definitely be able to taste. Congestion-wise, maybe you just can't smell. Or like your airways are kind of like restricted, so it's harder to differentiate different smells. But it shouldn't be like COVID, where I know with COVID we had like zero taste and smell, and it was prominent for many days at a time.
Right.
So that's something that would be common.
Yeah.
Although I wouldn't like dismiss it.
Yeah. And then going back to the chat, I see Lemon111. They said, is the new variant able to be detected by an at-home test?
That's a great question. For Kraken, yes. For Arcturus, we only have 15% of COVID cases so far, so it's not very common, or we don't have a lot of data, although the data that is out shows that it is being detected by our current test, because there's at least 15% of the population being detected. So I would infer that our home tests are okay. The thing that would make me think that our home test would stop working is if we start getting a bunch of people getting sick, and they do the PCR test and it comes back positive, but a bunch of people are also taking home tests and testing negative. Then I might change, but we won't know until we get more data. So we only have 15% of the population. So I guess TBD, although if they're already finding it in the patient population, our home test should be fine.
Yeah. Awesome.
Good questions. I like these questions, Lemon. Lemon111. Great questions. I love it.
Okay. And then another thing that also came up was, is there a link between, I know earlier, I think you spoke on dry skin with allergies a little bit. So something else that came up was, is there a link between allergies and like eczema?
That's a good question. Yeah, I mentioned skin with like itchiness and dryness can be a certain symptom. With eczema and allergies. So when we talk about allergies, we're talking about the immune system. Your own immune system kind of making a big deal out of something that's kind of harmless to you because it's a foreign substance in your body. So like pollen. Eczema is kind of similar in a way that your immune system is kind of attacking itself and causing these chemicals to be released, kind of like histamine, that causes your skin to be inflamed. So instead of your nasal passages or your eyes being inflamed because of the histamine that's released, the immune system is releasing other chemicals because you're exposed to something like food or even pollen and your allergies that can cause your skin to be extra irritated and inflamed. So there is some sort of connection. I did some reading and found that people who do have childhood eczema end up having adulthood allergies, or some people who have childhood allergies might also develop adult allergies and eczema. And that just has to do with your immune system in general being overreactive. So there is some sort of relation, and again, it has to do with your immune system. How do you kind of figure out how to navigate this? Because definitely is something that is difficult to navigate for people who have allergies that are really already irritating, and then you have eczema that kind of happens out of nowhere. Is you want to figure out with your primary care physician or your healthcare team, like the allergens that trigger it. So
Yeah.
some people have like wheat allergies in addition to pollen. So those are two things you kind of want to mitigate to help with your eczema as well as like helping with your allergy symptoms. So I'm so sorry to hear that, Quinzel. Thank you for sharing. But yeah, again, it's kind of I would think of it kind of in the same way. You got to find the cause, right? So if you find the cause, then your allergy symptoms and eczema symptoms can hopefully have something that is treatable and avoidable.
Oh, and then another question from Lemon. So if you take allergy pills, would that help alleviate eczema? Because as an adult, I only have had eczema.
Yeah, so I'm assuming you're talking about like antihistamines like Benadryl and Claritin and Allegra and that sort of thing. So the number one or the most common treatments for eczema usually have to do more of topical sorts of things. So topical steroids, so like triamcinolone. Some people might do hydrocortisone, that sort of thing, and that attacks the skin directly as far as helping with inflammation in that setting. Taking a systemic antihistamine might give some relief if you have other symptoms like allergy symptoms. I did some reading about with patients who have eczema, should they be taking Benadryl as well? Because it's basically your question. And they found that it was like 50-50 as far as the studies go. There wasn't like a significant difference in patients who had eczema and not eczema to like help with their symptoms. It might help with some people with inflammation, but it's not the best situation to be on Benadryl daily for eczema. There's other treatments out there that are even more advanced. So like you have your topical ones for skin, like hydrocortisone, triamcinolone, that sort of thing, and then you might have to do more of like immune suppressing agents. I guess I'll just keep it like that. So there's other agents besides Benadryl that are probably more effective for people with like severe eczema.
Yeah. Would you say I think it's hydrocortisone, like creams would help as well?
Yeah, but depending on how severe your eczema is, you might need to talk to your PCP about something a little bit more stronger. So the hydrocortisone at the store is like 1% or even 0.5%, and so sometimes that's not strong enough for if you have like a pretty bad outbreak.
Right.
So
Yeah. And then Quinzel says topical ointments are helpful.
yeah, no, that's a great question though, because you'd think because it's like, oh, antihistamine, immune system, maybe it's all connected, but there's a slightly different mechanism that's a little bit more complicated.
Yeah. And also, like, I guess I've been seeing asthma as well, with like connections between asthma and allergies as well.
Yes.
Similar to eczema. Do you think you can talk about that a little bit?
So can you say that last part you kind of cut off? It was asthma and...
Oh, asthma and allergies.
Yeah. So asthma is another disease that's kind of affected by your immune system. So asthma is inflammation of like the bronchioles or the airway, and caused again by triggers. So I guess the theme with asthma, allergies, and eczema is figuring out what your triggers are. So there is a connection. I know that with patients who have asthma, obviously their airways are already reactive, and on top of that you stack patients with allergies or allergic rhinitis. It's kind of the same area where you have like congestion in like the upper airway, that sort of thing. So there is some relation. For patients who have asthma that's not really controlled and also allergies, you might be prescribed a regimen of like an inhaler, a rescue inhaler. For your asthma, you might be prescribed oral antihistamine for your allergies. And then for patients who have both symptoms at night, a medication called Singulair, which is a prescription medication. They'll take it at night, and that helps with allergy symptoms at night, as well as helping to keep your airways clear while you're sleeping. So to kind of go back to this allergies and asthma thing, when we talk about asthma, and I think our next podcast might be about asthma, you might have to stay tuned, but to monitor asthma, a lot of the symptoms we look at are you getting enough sleep at night, or are your symptoms from asthma keeping you up? So it might be the same case with allergies. Are you having allergy symptoms at night? And in that case, you might want to do your allergy medications timed at night before you sleep versus in the morning. And so that's something that just came to mind as far as like timing wise. We try to time our medications for asthma to the times where we have the most like symptoms. Same thing with allergies, kind of can work the same way. If you have nighttime allergies, so you sleep with your dog at night and you're allergic to pet dander, maybe you want to take your antihistamine right before bed, so that way it has the highest effect.
Right.
So that's something that can happen as well. So yeah.
Oh, and Quinzel says, yep, apparently they call it the triple A. Allergies, asthma, atopic dermatitis.
Yeah, yes.
In their own circle, related to each other. There's connection.
Yeah. Ironically, it's because your immune system is trying to help you, but it's really not. Like, your immune system, like, yeah, I'm so strong, I'm going to take on whatever is happening to the body, but even the stuff that's not really super harmful to you, unfortunately, that's kind of the case, you know.
Yeah.
But yeah, it's about like timing your triggers, trying to optimize your medication, so you're not taking too many medications, but you're taking the best medications possible. Maybe having like a scheduled regimen, so taking things regularly, so that way medications aren't wearing off in your system too fast before your next dose. And it's kind of being aware of all of that at once. Unfortunately, they juggle with these sorts of diseases, but yeah, I hope those things helped. Those questions, those answers helped you.
And then another question I wanted to bring up that was actually, I don't remember who it was from, but they commented it on the IG Reel post on our page, and they asked, what is valley fever?
Valley fever. Yeah, so valley fever versus like hay fever, right? Because we're talking about allergic rhinitis. So hay fever is kind of like the slang term, I guess, for allergic rhinitis, which is allergies, seasonal allergies. Valley fever is a little bit different. Here in the Central Valley, a lot of us are higher risk of exposure to a fungus called coccidioides, and that can cause an infection called coccidioid mycosis. So this is a fungal infection. I don't know if you guys are fans of, what was the name of that, The Last of Us? That just came out, where people had fungal infections.
Somebody in the comments.
But I think it's called The Last of Us. Anyway, so people had fungal infections and that sort of thing, and basically said they couldn't be treated. The thing so kind of going back to your biology class, and this is what makes medicine and science kind of fun but scary. So when you look at the bacteria, and you have humans and animals and fungi are in the middle of bacteria and humans in the whole animal tree. So when you get an infection with fungus, The Last of Us was kind of creepy.
It was.
Luckily, valley fever is not like The Last of Us, so we're okay with that. But anyways, fungal infections are pretty scary because the medications used for fungus kind of can have a lot of side effects for patients. In this case with valley fever, this happens when someone might be camping or working in the farmland or doing something closer to where there's a lot of dirt in the valley. And when you're kicking up dirt, so you're driving a tractor or something like that, and you kick up dirt, these spores from this fungus can be breathed in and then can kind of seed into your lungs. And if you don't get that treated, or if your immune system doesn't fight it off, you can develop more severe infections, including some of the patients that I see who have coccidioid meningitis, which is an infection of the brain and spinal cord with fungus, which is kind of a really horrible Horrible
Yeah.
infection. But for most people, valley fever, if it happens to you, 5 to 10% of patients might have some infection that gets treated and then you're all good. For 1% of patients, they might have severe infections that affect their brain and spinal cord, and then you might have to go to like a neuro center like ours where you get long-term antifungals. So some of the common symptoms with valley fever, you might get shortness of breath, chest pain, muscle fatigue, the sort of things you'd find in any infection, except for they have to, hopefully your PCP does a good like investigation of where you got this. So I guess an example that I have is I had a patient who had a severe, they were maybe in their 20s. They went camping and all of a sudden, 3 months later, they had this really horrible headache, loss of vision, and when they came to our hospital, they ended up having a coccidioides infection, probably from camping, although we don't really know the cause. So knowing the cause and like what you did before you got the infection is important. And this guy unfortunately had to be on antibiotics for I want to say it was like, I don't know, 90 days, and I'm not sure what the, or not antibiotics, antifungals, sorry. Antifungals for a very long time. There were other complications. So it can be scary, but it's not super common, especially if you have a decent immune system. If you're immunocompromised, maybe I'm more scared about that, but that's something that can be talked about with your primary care physician.
Thank you for answering that. It is 5:41, and I believe this was set to end at 5:45. So as we wrap up, I want to leave this space for anybody in the comments to throw in everything, throw in your questions, and yeah, while they do that, Dr. Freddie, do you want to share your socials and maybe Echo on the Echo page? We can type out that in the comments.
Yeah, you can find me everywhere at TraumaCystRx. So I have a YouTube channel, TikTok, IG. Hopefully getting some more content out. I've been pretty busy with the Echo podcast stuff and other things going on in my own career. But always open to any questions. I know that some of you reached out after the allergy podcast, and I give you a little bit of a med rec or reconciliation of your meds. So if you have any questions, I do that for free and only to help the community. So let me know if you have any questions. Obviously, my inbox is open to the audience here, the community. I just want to be someone to help out and be another kind of eyeball on your health therapy and hopefully guide you in the right direction. My social medias focus on healthcare and making it easier for you, the audience, the community who might not be healthcare oriented. And also, I've had some videos helping students and learners who are in the healthcare field just trying to get by and learn new tricks and skills. So if you're into any of those things, please like and subscribe. More content coming out soon. But yeah, thank you for the opportunity.
Of course, and thank you all for joining us. Thank you, Dr. Freddie, for joining us for another IG Live. I know we have a few Echo podcast episodes coming out soon. I believe there will be one coming out tomorrow, so stay tuned for that. It may or may not be the allergy one. We'll see.
Asthma, maybe. I don't know. Anyways, before we go, I appreciate all these comments. I'm so glad you guys are learning a lot. That's the point. That's the point. As long as you guys learn, that's the mission. So, hope you guys enjoyed this. Maybe we'll do another IG Live after a couple more episodes so we can kind of get those ideas settled in. Haley, anything else before we sign off?
I don't think so. Just thank you again. Hopefully we can have more IG Lives. I really enjoy being in this space with you and love having the community be able to ask all these questions and get answers for free.
Yeah.
For free. Everything is free. But anyways, yeah, so we have your Instagram and all your other accounts in the comments. Make sure to follow Dr. Freddie on those. And our Echo Little Manila account as well. That's also in the comments. But yeah, I think wrapped up right on time. Thank you all for listening. Have a good rest of your day.
Thanks, everyone. Have a great week. Bye.
Bye.
Like, subscribe.